Hi, Paul Lenz, Senior Facility Planner, Wexner Medical Center. I'd like to take this opportunity to thank the entire IT team for its rapid response to Dr. Muller's request on having technology operational in Evans Hall in such a timely manner. It certainly was no easy task, and given the prescribed timeline, your team was able to assemble the right stakeholders, execute the design and installation in a manner that was well organized and coordinated. Thank you again for all your help.
Good morning, IT team. I'm Dennis Delisle. I am the Executive Director of University Hospital. I started back in May of 2020, and obviously this has been quite an interesting time to be in healthcare, and I wanted to express my appreciation and gratitude for everything that you're doing. In my prior experience back in Philadelphia, I had the opportunity to work with the IT team leading our Epic implementation. So I really have a great appreciation for all of the hard work that you do, understand the challenges that you're going through, and I really appreciate all that you've done to support the clinical operations as we're dealing with COVID. It's dynamic, it's challenging. I know that it's a lot of hard work. Thank you for everything that you're doing. We really appreciate it. I wish you nothing but the best during the holiday season. Stay safe, be well. Thank you.
Hello, IT team. My name is Mary Howard, and I'm the Executive Director of the East Hospital. And I'm so glad to have this opportunity to express my thanks to all of you for the many things you do day in and day out to support us in every aspect of care and services that we deliver here at the hospitals and throughout the organization as a whole. You've helped us in so many ways, when it comes to the help desk or the tech support that you provide for us. It's been especially hectic with the COVID crisis, and you have risen to every challenge. It's been a busy year for us here at East Hospital as we've opened up new units, the West Wing, Tower 3, Tower 9. We could certainly have not done those things without you. And more recently here with the COVID surge units and getting those opened up, and in particular, the fantastic work and the quick turnaround to get the Wallace Infusion Clinic stood up, as well as here this week, and all the work you've done to help us get Talbot Hall ready to open up as a med-surg unit next week. So I just want you to know how appreciative we all are of the things that you do. It doesn't go unnoticed, certainly, and I just appreciate having the time to say thank you.
Hi, IT colleagues. It's Amy Helder from Patient Experience. Just a quick note to let you know that I appreciate the work that you're doing on behalf of our patients and our families, and also the ways that you are reaching out and really truly supporting other departments. Clearly, it doesn't take a pandemic for you all to shine, but some of the examples that we've seen recently during these unprecedented times really have left a big impression on me and on our colleagues in the department as well. So I wanted to say thank you. I am not only appreciative of you, but I'm also super grateful. Thank you. Take care.
Hi, my name is Ryan Haley. I'm a Senior Director in Ambulatory Services, and I just wanted to take a brief moment to acknowledge our colleagues in IT who have been so tremendously helpful in supporting us through this COVID-19 journey over the last 9 months. Please know that your support has not gone unnoticed over this time period. We are so incredibly grateful in Ambulatory Services for your unwavering support on a multitude of projects, whether it be moving COVID swab stations multiple times over to helping out with our screening station activities. And most recently, our COVID-19 vaccine efforts, which are both exciting and daunting at the same time. I definitely feel like with your team in our corner that anything is possible. And I'm just always so impressed by the high level of quality of the work that you do, the speed at which things get turned around, and the level of professionalism and just overall knowledge that comes from your team. Please know we're eternally grateful and really think that we can do anything when we work together. So appreciate all you do. I know so many of you had to kind of drop what you're doing to cover things on an evening or a weekend or a moment's notice, and your dedication and accountability is incredible. And thank you so much for what you do for us. Hope to work with many of you very soon.
I'm Elizabeth Seeley, and it gives me great pleasure just to be able to tell you all how very much we appreciate all of your work. You are truly invaluable to what we're doing here, and as I think about all the initiatives that you all have implemented and made possible. None of it would have been achievable were it not for your incredible dedication and outstanding work. I think about the folks that had to set up the testing labs and the BRT and the testing for the Ohio State students, setting up all the different aspects we needed to enable people to work from home, setting up the swabbing stations and the multiple moves of the swabbing stations, serving as screeners at our entrances, and then as we prepare now, hopefully, for a vaccine, working tirelessly so that we are ready to do that as soon as it becomes available. And speaking as becoming available and making something happen quickly, the Infusion Center at East, there are just countless examples of what you all are doing to respond to this surge. And as we bring up new patient care areas or change the use of a patient care area, all of that requires your dedicated effort and tremendous work in a very short time frame. And as I think about just what you all are doing to respond to the COVID crisis, on top of that, we have a number of ongoing initiatives that you haven't lost sight of and have continued to implement, whether that was bringing Memorial Hospital live on IHIS or preparing for the Workday implementation or enabling people to work from home. There's nothing that we do that you all don't have to have a piece of in implementing. And so for that, I just want you to know how very much each of you is appreciated. No matter what your part is, it takes each of you. You're invaluable. Thank you very much.